Hi, hello everyone. This is Dr. Srinivasbj, consultant medical oncologist, first and finest pioneer in breast health, breast cancer specialist. So today we have chosen the topic of after completion of the breast cancer treatment, a particular patient what they need to do over a period of years. So what are the follow-up visits, how they have to change their lifestyle, what they have to monitor. So on these topics, we usually go in details in this live session. So any questions, any comments, you can type in the chat box. And we will answer as we go live. So before going into details of that, brief introduction about our nationwide campaign on creating awareness for screening mammogram, that is Mom, it's time for mammogram. Why this campaign is required? This campaign is to create a awareness for getting screening mammogram done for women, most of the women aged more than 45 years, maybe up to 75 years of age. Why this is required? Because most of the breast cancer diagnosed in India is advanced stage and we cannot cure that. And death due to breast cancer is high, though the occurrence of breast cancer in India is less, number is less compared to the Western countries. Though the number of breast cancer diagnosed is more in Western countries, but death because of the breast cancer is less because they are all screening mammogram detected cancer. Any cancer which is detected early, we can cure it. Almost 70 to 80% of the breast cancer detected in Western countries is through the screening mammogram, whereas in India it is less than 1%. So at least to one step at a time, we are creating the awareness to get the screening mammogram done for most of the women more than 45 years of age. Whether it is average risk women where none of the family member have any history of breast cancer in their family, we call it as average risk female, and their risk of having breast cancer in their lifetime is around 12 to 15%. Intermediate risk group where the risk of breast cancer in their lifetime is around 15 to 20%, and one of the family members in their family might have breast cancer as a history. So these women also needs to get the screening mammogram done. And high risk where there is a history of family history is also there, and there is a genetic risk factor. Genetic risk factor is there. So the risk in their lifetime is almost more than 20%. So the statistics have shown that around 20% of the deaths can be prevented because of the breast cancer by doing the screening mammogram and detecting breast cancer early. So that is why this campaign, please join hands and share this video as much as possible so that it reach and most of women that can get the breast cancer screening mammogram done at the age of 40 years, more than 45 years. So coming on to the today's topic of what a patient, what a female after completion of their breast cancer treatment, what they have to do. So most of you all know that any breast cancer treatment requires surgery, chemotherapy, and radiation. So which is the first, whether it is surgery or chemotherapy? So it is decided by your treating doctor depending upon the stage. Suppose it is stage 1, so usually the surgery is the treatment of choice. If it is a stage 4 disease or stage 3 disease, it is usually the chemotherapy followed by the surgery or radiation. So that is how your treating doctor will decide which one is the, but all the three modalities of required, whether it is stage 1 or stage 4 disease. So we can divide the discussion topic in 4 to 5 headings. So survivorship care, monitoring the survivorship care, cancer survivorship. So what is that? This is nothing but whatever the ongoing treatment is there, or just they have completed the treatment, or the any maintenance treatment is there, they have to continue the treatment as per the doctor's advice, and with regular visits to the doctor, follow-up visits to the doctor, and they have to monitor the late side effect of the treatment. So most of the chemotherapy or whatever the targeted therapy we use sometimes comes with a price. For example, some of the chemotherapies may cause cardiac side effect, cardiac failure. Sometimes patient will have a cough, difficulty breathing, congestive cardiac failure we call it as. So though it is a rare, but we keep monitoring for that. And once the treatment is completed, back to the normal life. How how to come back to the normal life? They have to go to their profession back, their office, or they have to go back to their work, whatever the work they have. So occupational rehabilitation, we call it as occupational rehabilitation. So these are the things cancer survivorship, any person affected with cancer and completing the treatment, they have to one they have to follow up visits for whatever the maintenance therapy is there, they have to monitor for the late effects of the treatment, and back to the normal life. What are the things transition, what are the steps they have to take to go back to the their work back. So these are the things you can discuss with your family members, with the treating doctor, so they can help you out in that. So the second most important aspect of post treatment is coping with emotional challenges. So most of our patients will have anxiety, depression, and more importantly, the fear of recurrence. Some of the patients we have seen that they come to the OPD frequently, within 2 months, 3 months. That pain in the chest, pain in the back, they are losing weight, and after examination, everything will be normal. So these behavioral will tell us that the particular patient is having a fear of recurrence. So there is solution for this also. We have to discuss openly with the psychologist and psycho-oncologist, psychiatrist, and your treating doctor. Depending upon the stage of the disease, we can also quantify what is the risk of the disease coming back, and that will subside the anxiety of that patient. And the impact of relationship. So there may be, we have to with the family members or with the psychiatrist, they have to work out the relationship on the husband and wife, husband and children. So any relationship problem may come during the treatment or post treatment. Especially we have seen where the newly married couple, immediately within 5 to 6 months of the marriage, the breast cancer have been diagnosed to the newlywed girl, and there were so many family issues, relationship issues between the husband and wife, between the family of both the husband and wife family members. So these are the things need to be sorted out, because this also will cause depression, anxiety, and will in turn lead to the stress on the particular patient. So the particular patient has to work on impact on relationship issues needs to be solved, and anxiety, fear, depression, and fear of recurrence. So these things needs to be solved before they embark on their post treatment journey. The third important aspect of post treatment journey is knowing the risk of recurrence. So it was what stage, what is the percentage of risk of recurrence to a particular breast cancer patient. Suppose if it is a stage 3, the chances of recurrence is maybe around 30 to 40% in over a period of 5 to 10 years. Suppose it is stage 1, it may be around 10%, 5% to 10% around in a period of 10 years. Is stage 2 also around 10 to 15% in a period of 10 years. And risk factor for recurrence. So this is these are the percentages, though it is in literature it says, but for the particular patient it depends upon the receptor status, the stage of the disease, behavioral biological behavior of the disease. So all it depends upon. So these are the particular just numerical values as per the literature, but it should not be taken strictly. And you have to discuss with your treating doctor depending upon the receptor status. They can give you exactly the exact figures. So apart from knowing the risk of recurrence in each stage, the patient has to also know the risk factors which can lead to recurrence. So post treatment, so much stress is relieved for most of the patients. That they start eating, diet will not be there, physical activity will not be there, pampering from the family members. So they start gaining weight, and it has shown in the literature or in the so much statistical examples that obesity or gaining weight, especially for the breast cancer patient, can lead to, it is one of the risk factors for recurrence. So not only the breast cancer, most of the cancers, it has shown that maintaining a regular physical activity post treatment, definitely it has almost 40 to 50% of the chances of recurrence have come down if a particular patient adopts a physical activity in their routine. Whether it was there before the diagnosis of breast cancer doesn't matter, but particularly after the treatment completion, they have to have physical activity and they have to maintain a ideal body weight. And the particular patient is already smoking or alcohol is there, so they have to avoid these, because once again these factors also increase the incidence of risk of coming disease coming back. So these are the risk of recurrence. One is the percentage, one is the risk factors like obesity, not having a ideal body weight, and if the alcohol and smoking is there, that needs to be avoided. The fourth important step they should adopt post treatment of breast cancer is lifestyle change modification. So I have already detailed in my previous factor explanation. Lifestyle adoption matlab, so any nutritional challenges, so they have to consult the dietitian, have a regular diet plan. It is said that more of vegetables, fruits to be included in their daily food plan. At least a two-third of their food in each meal should be of proteins, and that too from protein from vegetables, and one third should be from the animal proteins. So that is what the general nutritionist advice is. So depending upon your taste and familial culture, you can adopt a balanced diet, so which is very important in avoiding the obesity, in avoiding overweight, and have a more energy post treatment. So binge eating should not be there post treatment, so that if you eat more nutrition, so the body is able to tackle the cancer. So that is the myth. So we have to have a more protein and well balanced diet, and well added to that physical activity. So this is the lifestyle modification most of the people should adopt. And So last factor or last thing which most of the patients should adopt is follow up and care. They should have a follow up plan. So most of the breast cancer patients, after the completion of treatment, what we do is we do regular physical examination of the operated site, the examination of the opposite breast, and every once in 6 months we can have ultrasound of abdomen, the mammogram once in a year of the opposite breast if it is one of the breast is completely removed. And usually sometimes we do PET-CT scan once in a 6 months, though it is optional, it is not a mandatory, but we do PET-CT scan once in 6 months for 2 years and then once in a year almost for 5 to 6 years. So this particular follow-up plan should be there, and we should not miss any follow-up visits with a doctor. And sometimes whenever the breast cancer patients are having hormonal treatment, there will be bone strengthening injections once in 6 months. That also they have to keep in mind before going to a doctor, and they have to regularly visit once in 6 months. Regular visit for this injection is mandatory, and they can have a normal life. They can have uh, they can do their office work. They can have their normal routine as it was there before the diagnosis of breast cancer. So normal routine they can follow during a post treatment post once they complete the treatment plan. One more important topic is the sexual life, impact on sexual life. Definitely this needs to be discussed with the partner, and there will be body image issues, especially for the females. After the suppose there is complete removal of the breast, mastectomy we call it as, either the implant surgery they can do, a reconstructive surgery they can do. So these body image issues needs to be tackled, and it can be tackled completely successfully, and they can lead their normal life. And more importantly, very rare cases of second malignancies we have seen post treatment. Maybe in my 10 to 12 years of experience treating the breast cancer, around 2 to 3 patients we have seen where the patients have come up with blood cancers. So very rare, maybe 1 to 2% chances of having a second malignancies, second cancers coming up in their treatment journey. So they should. That's why the follow up visits and follow up blood test, and I'm in monitoring for the late side effects is mandatory. So this is all about what we need to do post treatment, post completion of treatment of breast cancer. So anything, any questions, any comments are there? I'm ready to take up. Please message me for more details. So we will end the live discussion here. Thank you.